Hello.
Hey, my name is Sam. I'll be your student nurse. Can I have you confirm your name and date of birth?
Sure, my name is Pete Bayless, September 23rd, 1994.
All right, thank you. So, what brings you in today?
Head to toe assessment.
Perfect. All right. Do you know where you're at?
The hospital?
Perfect. Do you know what month it is?
November.
All right. So you are A&O times 4. You know what's going on here? Right now, I'm looking at the patient's appearance, seeing if there's any obvious signs of deformities, seeing if there's any use of any mobility aids like crutches or canes. I'm also looking at his mood and his effect and tone of his voice. Seems to be in a good mood. All right, so now that I've done the visual appearance, if we need be, we would go ahead and do height and weight. They've already received your height and weight. I had it in the chart over here. So while you were off to get your height and weight, I noticed that you had a good even gait. Again, you're not using any mobility devices. So now we can move right into your vitals. Do you have any allergies?
I don't.
Okay, perfect. So let's start with your SpO2. If you could, just give me your index finger. Perfect. And you can relax your arm right there. Yeah, on a pain scale of 0 to 10, do you have any pain today?
0.
0 pain, that's perfect. All right, your temperature was good. It was 96.9. Right, good job. Pulse ox looks good. Pulse is a little high, but that's probably because we just drug you over to the scales to get your height and weight. Do you have a preference on which arm that I get your BP on?
All
Alright, perfect. Just have you slip your hand in there. Looks like a big enough cup for the big old arms of yours. You work out?
Not since I started nursing school.
I gotcha. I can relate. Alright. Oh, thanks for that. Yeah.
Sorry. I didn't even get it on there. Just balancing.
All right, you can just relax your arm. That way I don't have. Perfect. What's your BP normally at? Do you know?
Usually runs a little high.
Runs a little high? Okay. Okay. Yeah, it was a little high. It was 130 over 85 or 86, sorry. I'll go ahead and just put that into the charts real quick. Okay. So now that we've got that done, I'm going to move on and we're going to get to the actual head to toe portion now.
All right.
So basically what I'm going to do is I'm going to start at your head and I'm going to work my way down. We'll just assess everything. I may ask you a few more questions about pain in certain areas, and then I'll actually have you do some mobility movements as well, okay? All right, so let's start at your head. I'll start at your scalp. Checking to see if it's dry, making sure that the hair is evenly distributed. Everything looks good. I don't see any signs of redness, no lacerations. Then we can move on down to your eyes. I saw that you had your glasses. Are those everyday wear, or do you use them just for reading, or?
Everyday wear.
Everyday wear, okay. All right, if you wouldn't mind taking a look at my nose. Right now his eyes are looking equal. So we're gonna shine the light. Positive reaction. Positive reaction, all right. Now keep your eyes on this pin. Follow the pin. Last one. Perfect. Thank you. All right, so that's good. Eyes have pearl up. Now I'll take a look at your ears. Do you ever have any pain in your ears? You got any pain or anything?
Nope.
No? I see no signs of drainage. I see no lacerations. Look at this eye. Everything looks good in there. If you wouldn't mind looking up at the ceiling. Septum looks good. It's nice and even. No obstructions, no lacerations, no drainage. Same with the ears, no drainage. Now, I don't have a tongue depressor, but if you wouldn't mind, just go ahead and open up your mouth. Tongue looks good. Mouth looks clean. No signs of lacerations or anything in there. Trachea is midline. While I'm here, nope, no signs of JVD. Would you mind tilting your head towards me, looking towards me? Yeah, perfect. Yeah, no signs of JVD. All right, now that we have that, I'm gonna move on to the respiratory. All right, so if I could, I'm gonna place this on your chest, and when I place this, can you please take a nice deep breath for me? Okay. I'm gonna go under your shirt. Okay. All right, deep breath. This side. Deep breath. Nice. Come right here. Nice. And then last time. Perfect. If you wouldn't mind sitting up for me, and then I'll do your back. All right, go ahead. Good. Nice. And last one. Okay. Everything sounds good there. We can move on to cardio. So first thing I can do is I can palpate your carotid pulses. Do you have any history of heart disease in your family?
In my family, I had a cardiac catheter ablation in 2019.
Okay. And is everything pretty much resolved from that, or do you have to go with follow-ups, or?
Nope. No, yeah. All resolved.
Okay, nice. All right, you had good carotid pulse. And I'll auscultate in all of the 5 points. Again, I'm going to go under your shirt. I'll start on this side, and then I'll be working my way down around your chest. Okay? Second intercostal space. Good strong love dub. Good strong love dub. I'll come around this side, make it a little easier. And then I'll do the point of maximum for at least 1 minute. Perfect. Everything sounds good?
All right.
Just update that on the chart real quick. Next is going to be gastro, so I'm going to take a look at your abdomen. It would probably be best if I lean the head of your bed back a little bit. If that's all right. That's one. 2, 3. There we go. All right, that's probably good enough. So we will first look at it. Everything looks good. And I can auscultate all 4 quadrants. Starting at the upper right. The vowel sounds. Perfect. Alright. Now I'm just going to do some light percussion, okay? Everything sounds good. I'm just going to palpate in circles. Have any pain?
Nope.
If you feel any pain, just let me know, okay?
Okay.
Are you having good regular bowel movements?
Mm-hmm.
Okay. All right. That looks good there. I'm just going to take a look. I can have you sit back up. Sorry about that. All right. Now just take a look at your extremities and we'll do some range of motion and then we'll wrap this up, all right?
All right.
So, if you could, show me your hands. Let me see your fingernails. All fingernails look good. Cap refill's good in both. I have peripheral pulses. Color, condition, and temperature of the skin is appropriate. The color is appropriate for his ethnicity. The temperature is warm. Hair is nice and evenly placed against the arm. There's no lacerations. Same thing with the legs. I see the hair is evenly distributed. We have good strong pulses, no signs of edema or swelling. Cap refill in the toes is less than 3 seconds. Okay, now we'll just do some range of motion and some strength testing. So first, put your hands out straight in front of you and try to push my hands down. Perfect. Now flip them and try to push my hands up. Perfect. Now squeeze both my hands. Awesome. All right, and if you could just do some basic arm lifts. So just come from here and put your right arm up, all the way up, and then all the way back down. Any pain?
Nope.
Left arm, can you do the same thing? Perfect. Legs, I know that I saw you walk to the scale. Everything seemed fine. Did you have any pain or anything like that?
Nope.
Okay, all right. All right, well, I think that's it. Did you have any questions for me?
Nope. All good.
All right, thank you.